Welcome, everybody, to episode 25 of PT Shop Talk. On today's episode, we talk about imaging and its value in therapy, and we finish with our top 5 favorite cartoon series growing up. With me today, as always, is Nick Thundercats Stoling and Jeremy and Stimpy Van Klompenberg. Welcome, gentlemen. I know it wasn't He-Man, Nick, but it was pretty close.
I would have also accepted Cobra Commander.
I can't do the Cobra Commander / Starscream voice. It's too high and scratchy.
Yeah, same dude, right?
Yeah, I believe so. Same guy. Guy was all over that voice. It was very unique.
It was kind of like, no, Destro.
Yeah, like a little higher though. Like even.
Yeah.
You
could have did it. You could have did the. Skeletor is pretty. Okay. No, Destro.
Keep working on it. We'll get it next time.
Yeah, we'll
get back.
We'll circle back to that.
I was expecting more of a Skeletor.
McDonald.
Yeah.
Yeah, there you go.
He-Man.
Oh, that was pretty good. Yeah, all right. Oh, well, we're getting there. We're getting better now. Well, this is exciting. Episode 25. That's people like numbers that end in 5. So it's like a half a year. That's
quarter of a
solid.
century.
Pretty cool.
Yeah.
When we first started this thing, I thought we would do like one a month or one every other week. And here we are. We've continued to maintain a weekly schedule. Pretty good.
Yeah.
We probably should have had
much riveting
more ideas in the bank when we started.
So much hard-hitting content. It just
keeps rolling. Just keeps rolling.
Machine. Yeah.
So I was thinking this week, do you guys ever have like a character in a movie or even a TV show that really like connects with you where you're like, that's like me? Like I really feel like this character is speaking to me and they're almost me in real life.
Are we going cartoons here or
no? Anything because I have this person in my life now.
What? Tell.
Go on.
It's the dad from the movie Beethoven.
I have Charles Grodin, right?
Yeah, I have this new dog. If you guys are ever sitting around in the evening and you're like, I wonder what Casey's up to, you dust off your VHS of Beethoven. You put it in your DVD VHS combo. You fast forward about 25 minutes and just watch the next half hour. That's my life now. I am that man. Every 2 seconds. It's like why did we get this dog? We should have never brought it in. Let it go. Yeah, that's my life. The puppy stage it's strong. It's not enjoyable.
Yeah, just let him die. Don't replace. You guys just buried your cat. Now you're
like
a little pooch.
But if my dog dies now, people are gonna assume I killed it. Like I can't I can't really hide the fact that I murdered it. Like I'm suspect number 1, especially now we have this podcast.
Yeah, a lot of evidence out there.
Yeah,
they'd have to
too
dig
much.
deep to find.
Go figure, Casey. You'd
6
ask
feet.
us. You ask us a question and make it all about you.
The last shred of evidence.
Well, no, you gave me nothing.
25.
Yeah.
I don't know that I've had that person. I don't know that I could.
I got Jeremy. I got you. Did you ever watch Night Court? You're Bull from Night Court. Come on. Come on. No.
All right. I go.
Nick, I assumed Matthew Modine Vision Quest was you number 1. I can't believe you didn't just fire that out.
Back in high school, yeah. I went through a little Ari Atras phase maybe in my mind.
Okay. That was you as the manager?
Aren't there just some Jeremy, validate that, don't validate.
Yeah. Just dropping F-bombs on phones.
Times where I just slam my office door shut and just scream F-bombs nonstop.
And like the door is paper thin, so it didn't do anything to disguise
Figure
it.
it out, Van Kloppenberg. Figure it out.
Only if it was him, he'd be yelling like with you in there, just berating you. Lloyd, get in here.
Oh, Lloyd. Oh, what a guy.
That's a little bit. I think that show got a lot of flack towards the end, but very enjoyable through its entire run, though. A lot of fun.
Oh yeah, I don't know how many seasons it went, but I would say like the first 3 were pretty solid.
It was on my
fun.
short list.
I enjoyed it. I mean, I suppose it hit right when I was probably about similar age to those guys, a little tiny bit younger, but
I mean, the lifestyle is pretty cool. I mean, totally based off Mark Wahlberg, supposedly, right?
yes.
His coming up, and Johnny Drama is supposed to be his older brother, Donnie.
That makes
Pretty
sense.
Cool. Yeah. Hey, Jeremy, though, I want to ask you. You said you started True Detective on my recommendation. What are your thoughts,
dude? So I didn't realize that it's like a new story every season, right?
Yes, correct.
So, man, the first one, I finished the first one. That was good, man. I was thinking, right? Honestly, I was thinking at the very end of it when they're at his like kind of farm in the bayou and they're going, come on, take the path of the bride, right? And they like go to that stack of clothes, and I'm like, that is by far, that had me on the edge of my seat. I was like, for way longer or way higher intensity than anything in Stranger Things.
Awesome. Yeah. Right.
That was.
And with an anthology series, like anybody can go. I mean, they're not relying on McConaughey to come back.
Nope.
You know?
And I was even surprised he did, spoiler alert, at the end.
Yeah.
I thought it was just like,
I thought
okay, we're done. I thought they were both done. I was like, they're all gonna die in there. No one's ever gonna know. They're never gonna catch the serial killer. Like, that was good. That was good.
Awesome.
Yeah, I don't mind the anthology style storytelling. I think that's kind of fun. I'm a big American Horror Stories guy. I think that show's super fun for the same reason.
See, I've never seen it.
Ooh, I like horror and you like anthologies, I'd watch it. I've
heard it's well made.
Yeah, and like every season interconnects, which gets kind of weird later on because you'll get seasons where the actors might play 3 or 4 characters in the season. Because it'll be like their character from previous season is now interacting with their character from the current season. So that's a little confusing sometimes. It doesn't happen a ton. But it's not typical that they'll be in a scene together, but they'll do a scene as one character, maybe have a flashback to a scene with them as the other character. So you really have to, it would be a little confusing to jump back and forth. I would definitely watch it in order. But
on that Stranger Things note, though, they dropped the newest final trailer, I think, for Volume 2 a couple days yesterday.
8 days away.
Oh, so
the first, right?
Yep.
Yeah, just as I was kind of mellowing on it a little bit, but then I watched 2 full minutes of like, got me drawn back. Right in.
Sucked you back in.
Yeah, can't wait. Can't wait. July 1st.
I also had some exciting media news today. I'm not what we would call like a giant comic book guy anymore, but there's been like a comic series, I believe it's Japanese, called Berserk. They've been writing it since like 89.
Sounds crazy.
Yeah, it is a very crazy series, and the artist / author of it just passed away unexpectedly last year.
Wow.
And like they're supposed to be finishing it. He's like, there's probably like 100 chapters left in this thing, and he just died like a heart attack, and like they didn't know if they were going to finish the series.
Yeah.
It was like, wow, you've been invested in this thing for 30 years and now it's the ending. You'll never know. Because it is definitely a self-contained story. It's not like a superhero book where you just, it's just going to be serial stories.
Alternate. Yeah.
But yeah, they
47.
Like the last 5 years of his life, though, he brought in some assistants and he was teaching them how to draw like he drew, and he had them do like a second series on the side and they'd help him out. But people didn't know, like, well, they can't really take it over. But apparently, like, his best friend's also like a comic guy over there, and they have been talking. They've been like friends for 40 years. Like, they started writing their comics at the same time. So this guy apparently knows like how it's supposed to end. And so with his family, with the original guy's family's blessing, he's decided he's going to take everything he told them and he's going to get with his assistants and they're going to finish it. So yeah, like the first issue just dropped this week. So pretty cool. They did a great job. I mean, quality is not lacking. So that's exciting. I was really concerned like 30 years was just going to poof away with no ending. So.
And the Japanese don't play games with like their comics and their animation.
No, it's this one's pretty brutal. Like it's kind of cool story. Like the guy, he's like a mercenary. It's more like a medieval type story, and he gets with these bands, and he's like the best. He's a super good swordsman. Anyways, he leaves the band. The leader of the band ends up getting captured by another army, tortured, and he ends up sacrificing like all his friends to these demons to get these powers. And this guy's the only guy in this whole band that survives. Him and his love interest, but she goes crazy. So then the story is him trying to like.
Who hasn't seen that play out?
Yeah,
like,
the story is old as time. Yeah.
And then when does Batman come on? When does Batman show up?
This guy is pretty much a Batman with a giant sword. It's more like a raw slab of steel, as they say, because his sword's
How
like
about
7 feet long.
Iron Man?
No, he's
Wolverine.
definitely not. He's not charismatic at all. It's just a stone cold murder.
Schnickety.
Oh, look at that chibi art. That's cute. So, anyways, that was big for me. That was exciting.
Cool.
Yeah.
Berserk.
Look it up sometime. There are some scenes in there that are, well, 90% of it's not for kids, but definitely there's some scenes that are barely for adults in there, but it's good.
What is that? Oh, okay.
I'm scared. Oh, God.
I would say you read like this was like issue 366 that just came out. I would say like the last 50 issues, his artwork is absolutely phenomenal. I mean, if you Google just Google Berserk incredible artwork.
We need our producer to like really slap some stuff up for our YouTube followers.
Yeah.
Berserk.
Yeah.
Berserk.
Well, yeah.
Yeah, this guy would take like 10 days to draw a single panel. It was crazy. His art style is phenomenal.
Are the pictures as lucid as perhaps some musculoskeletal imaging? Like a CT or a T2 weighted MRI?
Yes and no. I mean, oftentimes he would cut people in half and you could see inside of them like you would with imaging.
Coronal
transverse. He would do all the cuts, really.
I'm excited.
Sagittal.
Now you got me into it.
Yeah.
Sagittal slice, yes.
Oh yeah. What's the sunrise? You jam a sword right through their mouth. I mean, he did them all.
Right through the patella, sunrise view. Yeah.
Oh yeah. What's the one through the mouth?
Open mouth.
Open mouth.
That's a crappy name for that one.
C1, C2.
Yeah, that's just called an open mouth. That's dumb. All right.
I think so, isn't it?
And I sit in the state where I can actually. I'm in the state where I can actually order these. I should learn these, I guess.
Yeah.
You can order.
They call that a sunrise view because you open your mouth at sunrise.
Yeah, like you're yawning and you're having your coffee.
Yeah, there you go. You see a patella in there, that is trouble.
That is trouble.
Named right after the sleepiest people around.
Well, open your mouth and you show your brain, as they say. I'll move on. Let's talk about imaging for reals.
On that note, Jeremy is just fired up about imaging this week.
You know, part of it for me, like I was saying a couple weeks back, like I don't know what you guys feel about this, but you know, like talking about kind of like the lifestyle medicine or public health type initiatives. It's like this is one of the things that I think is just like a huge barrier. It's not well understood by the lay population. And so I just think it's good information to get out there. I would say that probably at least 90% of my patients I try to educate on imaging because most have had it or are saying they need it. You know, so I mean, you guys mentioned it. I don't know that we have to go super in depth on that, but I mean the most common things that I see, at least in our practice, of X-ray, MRI, and CT. So interesting, you know, things, right? Like you'd say like our MRI and CT are like more advanced imaging, X-ray more plain film, you know, basically just ruling out fracture on that. But yeah, like interesting how many primary care, you know, like, oh, they said my rotator cuff's fine because I had an X-ray. You know,
X-ray.
Yeah, definitely hear that for sure.
Yeah.
And I had a patient that came in the other day and they're like, but you can't see muscles on an X-ray, can you? I'm like, no. I'm like, you know, you're trying to like toe a line there, right? Because like, not trying to throw the provider under the bus, but you're like, Well, I guess in some cases we could say if we had, superior migration of the humeral head, you might be able to jump to that conclusion.
That would have to be chronic though, right?
Yeah.
Chronic, yeah.
Yeah. So I'm like, trying to go through that, but again, the bigger piece.
Good chance just to educate them and say, hey, let's just handle this thing clinically. And if you have signs and symptoms that indicate it, let's shoot you for an MRI, right?
Yeah, you got it. But it's like, what I find is like, yeah, did an eval this morning, 33-year-old with intermittent chronic back pain. He's like, well, I have good days and I have bad days, but now I found out I have DDD, and like,
might as well.
And this guy actually was like, but I did some Googling, and they said like it doesn't have to be a bad thing, and I just need to strengthen around it. And you go, oh, this is a great guy to support that with. But a lot of people are like, you can't fix me because I have this disease now.
I do think we're slowly seeing that narrative change.
I
would say
I was just going to say the same
years.
thing. Yeah. I just had somebody last week who, and it kind of echoed exactly what you said. Like they listed it, but then at the same time, they're like, yeah, but it's no big deal. I guess everybody has it. Like,
well, yeah, I've started to see some providers, orthos included, kind of giving that same message too. Like, it used to be like, yep, let me know when you want it fixed, and now it's like, well, there's a good chance you can feel better just with some exercise and strengthening, and we'll send you to therapy, instead of you got to go fail therapy so you can have insurance pay for your surgery. I mean, that's not a common message anymore, where I would say even 5 years ago, that was a pretty common message for patients I was seeing.
I would say out here, I feel like we're a little bit behind the curve. Like, honestly, like right before we left, I went to that rehab symposium with OI, and they were getting into a study on like, how do we rehab massive rotator cuff repairs, right? And that's like, you go, that's cool, I think. And do we see the outcomes that support surgical intervention, especially with advanced age? And but then I moved out here, and it's like people were still getting, 52-year-old patients were still getting 2 weeks of home health for total needs. So it's like
that's going bye
again. Yeah, and
sure.
It has, even in the last 4 years that we've been here. Now we're starting to see that, but I would still say we get a fair amount of people with that message of, I can't believe you walked in here. Oh my gosh, how do you function? Right. And we got
knees of an 80-year-old.
Yeah.
Worst whatever I've ever seen. Yep.
Yeah. So to me, I guess that's what I would say, where I see imaging a lot. I guess we can jump around a little bit. I mean, like, how do we use them in practice? Like, I'm not in a state that can order a Casey. You could maybe, extrapolate on that a little bit more. But, I look at, go ahead.
Yeah, it's, it's new for us. It's been this year alone. So, or last August, maybe, they ruled in on that. But again, it was just plain film, which was a little frustrating because when the board originally brought it up for vote, it was MRI, CT, plain film. Medical doctors, Kairos pushed back really hard on that, which I don't know. Kairos pushed back hard on all of it. Right. The docs initially pushed back hard on it, and then we said, all right, well, what happens if we just do CT and X-ray? And then they're like, okay. And then they came back again and said, nah, we thought about it. Just plain film is all we're comfortable with. And it's so silly to me because, like, the whole reason
radiologist is going to interpret it anyway.
Yeah, exactly. Like, we're not taking business away from you. We're doing this so that when patients come in, we can provide best care possible. It's silly for me to come in and say,
was there one plausible public argument that they're worried about overutilization?
Yeah, that was overutilization and incorrectly ordering those things. And it's like, I'm only going to order MRIs if I think somebody's got like a tumor or serious spinal pathology. I'm not ordering MRIs because somebody's got a sore back, but and then came in with the research we had on it, and PTs was definitely, we underutilize it. We probably miss more than we catch, just because we are still hesitant to order it.
I was going to say, I think it would help us swing our pendulum more to the midline, because I feel like our profession the last 10 to 15 years has been very anti-imaging. and that's probably what's going to come across a little bit in this pod, but not by intent, I'm sure. But I think it would create value for us to maybe have that ability to order it in those certain cases where it's going to help you with diagnosis, help you rule something out, or make a referral out. So I mean, I think there's a lot of value in it. I hope you guys are doing more and more of it.
But that's what I was going to say, like where, we talk about where would you utilize it, right? Like I'm thinking, super acute injuries, right? Somebody's positive for Ottawa rules,
we have pretty solid Ottawa rules, neck, ankle.
They are.
I mean, boy, you don't have to be a genius to follow those.
Yeah. So like you have those CPGs, like, and then, it's interesting, that argument on overutilization, because typically it's like, no, you have to go see your PCP first. Okay, you're going to get an x-ray. Okay, you're going to get an ortho referral. Okay, you're coming back to PT. Exactly. So it's like, in terms of the cost loop, to me, it's nuts, because it's like,
probably more cost effective.
You're right. So it's like, versus if you go to that and you do, like, you say, hey, we have Ottawa rules. Yeah, rule in, rule out. You need an image or you don't, and then go from there. I mean, like, that's what I'm thinking. You have your serious red flags, like you said, tumor type presentation, Casey, or, acute fracture or something like that, or a foosh, something like that, where you want to say like, hey, let's make sure we rule this out before we go on. So, but I would say our CPGs, CPRs, whatever you want to call them, I think they really guide the selection of imaging more than what we would see in the normal, transition of care. So,
but unfortunately, like a lot of the people who are managing payment on all this stuff, they're still the same people, as we pointed out before, that are they're going to scrutinize therapy beyond $850 on a calendar year, but really don't bat an eyelash for a $25,000, $30,000 surgery.
Yep.
That probably has like a 30% efficacy over 5 years.
Yep. Yeah. So depending on age group, depending on severity of tear, all those things, right? Like so many factors, but, we were going to talk documentation, and, that's, I wouldn't say like poo-pooing imaging, Nick, but I would just say like, research that says like, hey, we see this in both symptomatic and asymptomatic populations, right? The big study, I never know how to present or pronounce his name, but Brinkiji, is 2014, 15, systematic review, 3,100 patients, where you're basically saying like, hey, these are common findings on an MRI for a low back pain patient.
73% had bulging discs.
The one I started with was disc degeneration, in the 20s, like 37%, and each consecutive decade, then in the 30s, it's 52%. It goes up from there.
And you're finding even more other areas too. It's kind of cool as time goes by. They're finding like hip scopes, right, are becoming less and less necessary, truly, because
that was the same thing. Frank in 2015, for FAI, high incidence of pincer pathology, labral tears, 69% of the study in asymptomatic people. Gill in 2014. Conclusion: shoulder pathology is apparent in both symptomatic and asymptomatic shoulders, and clinical symptoms may not match radiological findings. The cost and burden of ordering MRI scans is significant, and the relevance of the findings are questionable when investigating shoulder pain.
Yeah, right? I mean, you can just go down the line for everything. 30% of collegiate basketball players have knee pathology, and they play college basketball without pain. So it's an education thing. But I think for me as a therapist, knowing that stuff, like Nick said, though, I think you have to be careful not to let the pendulum swing so far where you're like, they're worthless, I'm never going to order one. Because I do think, when we talk about like myelopathy clusters, cervical instability testing, if we're going to do those tests, it's so nice. And that was one of the arguments we brought up, was if I'm going to do a myelopathy cluster with somebody and not have anything for them, like that kind of stinks too, to go, well, boy, you have a positive Hoffman's, and you're hyper reflexive. That doesn't sound good. I'll see you later. Like call their primary and try to get something set up. But like, it stinks to be like, we do all these testing to identify these things, and then I have to send you somewhere else for
You're
somebody
still
to
handcuffed.
go through the same process. It's like,
but are you still like, for you right now, as somebody that can order it, are you sending them to Sanford, or are you sending them to, is there an independent lab that you're sending to?
Independent Diagnostic Imaging in Fargo would be, I talked with them back in August when this whole thing was coming about, to talk about order sets and what it would look like to order. The issue we still have, and I don't know, because luckily I haven't had most of my patients are pretty chronic. But yeah, it's insurance. I can order it, but is it going to get paid for? We had a imaging guy come in and through the North Dakota APTA and give a presentation, and boy, I can't even remember what state it was right now. Illinois, maybe, or Ohio. But he said every single image they had ordered in their hospital has been paid. And they had that same question, like, is it going to get paid? But
is that billed under the hospital, and not under provider? Right.
So I don't, but still, if I sent it to IDI, they're going to be the ones that bill it. So it's not like they're necessarily, unless they audit the account, I suppose, and see.
I'm sure they still need some type of ICD-10s to help justify it on their own side.
And that's what I said when I called them. They're like, well, we'll code it, and we'll do that part of it, And they even went as far as to say, we'll hook you up with PACS. That'll be a free service if you send us patients for imaging. We'll give you server-based PACS so you can, get all that information right away. So that was cool of them too. Like I said, it really hasn't become an issue since, so I haven't had to pursue it. But be curious. No. I just had to send somebody in to get an ultrasound for a DVT, but I would have had to send that out to the hospital anyways, probably. But
but it's like, I agree with you guys. I'm not like hardline on this, telling people like images don't matter, right? Like but I tell them that like, does this mean that they can't be a problem? No, it doesn't. But it means that it doesn't always have to be a problem too. And when we look at like pure statistics of, tumors with low back pain, things like that, what do they say? Like less than 2% of the low back pain that you see in your entire career will be a red flag pathology.
Yeah, right? I think generally 1 to 3% of all patients we see will have a red flag. I mean, that's I think what we say in school.
So you're talking, right? Horses, not zebras, but it's like I would say for the vast majority of the patients that we see, I think a lot of times that imaging does more harm than good. My hot take.
I think it comes down to how it's presented, though. I think you're right. I agree. I think you're right, unfortunately, but I think it's gotten better.
Yeah,
I think it used to be.
I think it's getting better. Yeah,
I think it used to be a lot more challenging. But at the same time, I think there's still a place for it in the right circumstance. I think it's the way it's messaged as it's interpreted. I think some of the worst stuff is when you get those patients who just receive the report and there's nobody to kind of walk them through it except for us. I say it's a good thing, bad thing, because they might show up in maybe a heightened state of concern. Yeah, but then you can really, break it down with them and say, okay, this is kind of normal. Oh, this is normal. Especially on the impression. When you go through the impression at the bottom, I mean, the radiologist is going to really define how severe something is or not, relative to what they've seen.
Yeah. Yeah, I always think it's funny when they'll, I shouldn't say funny, but they'll come in with that image, they'll be like, yep, degenerative joint disease, degenerative disc disease. And then the impression will always have, like, oh, there's some nodules in the kidney or like some calcification of the bowels or something with the liver. Patients don't think anything about that. They're like, meh. The report says it's, maybe worth following up on, but I'm not too concerned about that. But this disc disease, that's the real concern. And it's like, I'd be, how are your kidneys working? Like, how you feel? Like, like it's always interesting to me what people focus on. But have you guys ever had a non-red flag imaging that's changed your treatment?
No.
Yeah, that's
the big thing I get a lot, right, is I was talking about this actually with the nurse at the other day, where it was like, with the change to EMR, right, the assumption that we have access to all the images. Oh, you can see those, right? I had X-rays 5 years ago.
Well, I was going to say, like, one of the things that I actually enjoy is when people come in and you're meeting them during evaluation and they're like, oh, didn't they send that to you? Didn't they send you my reports? And I'm like, maybe they did. And sometimes it's just still floating through Meditech here, but I'm able to say, you know what? I'm better off not seeing that. I don't want it to bias anything that I'm going to do today. I think that right there helps them build some respect, because I'm like, I'm certainly going to cross-reference that, but I want to come in with like kind of open eyes and not have any type of, kind of bias on where I'm going to go based on any findings,
Yeah, I like that. I most of the time I'll tell people, like, it's not going to change our course of treatment. Ultimately they looked at, again, direct access or not, we can go back and forth on that too. But I go, I also trust that your provider is not going to send you here if they don't think it's safe. And two, if we find anything that we would determine that's not, then, obviously we're not going to have you here in an unsafe manner either. So it's like, that's some ways that I'll try to, just kind of preach that too. It's like checks and balances too. Like, they saw you, we're going to do our own evaluation. Again, like, very safe going forward, not going to change our treatment plan.
Yeah.
So
nice little approach there.
Yeah, I like that. And sometimes if I have it, I do look at them just so the patients feel confident that I know their whole case when I come in. But I say the same thing. It's we have to appreciate what's going on in the body, but we also have to understand that it's safe. We know that now with everything we've talked to with the doctor, with you, and what we looked at, and it's not going to necessarily affect how we treat you. The good news is we know that with the stuff you do have, you're going to be okay. So
yeah,
you can kind of justify that too, because you do have some patients where, like, I do think if nobody would give them an image, they would sit in nocebo hell, just worried about the worst things possible.
You get that all the time.
There are times
I need the MRI. Well, why do you want the MRI? Or you'll say, like, hey, my knee hurts. Okay. What's been going on? I tripped and fell 2 weeks ago. Okay. Well, what's your goal for therapy? I don't want to be in pain anymore. Okay, that sounds good. And I definitely don't want to have surgery. Okay, that sounds good. But they wouldn't give me an MRI. What do you want an MRI for? Well, I need to know what's going on. You're like, well, okay, so you don't want surgery. This is a rare event in time, but I just need to know what's going on. And I think, honestly, a lot of providers probably, like, kind of bend to that pressure a little bit too, especially in the age of NPS and, reimbursement based on satisfaction. And, and it's just like, my doctor wouldn't give me an MRI. And it's just like, again, we talk about time constraints, but dang, you're trying to do like a H&P in 35 minutes when you're going over every system as a primary care. I can see how sometimes it'd be like, all right, let's order it.
Check.
That'll make you feel better.
Yeah.
Peace of mind.
Mm-hmm.
But then again, it's like, then we come back to the age-old discussion of, why does healthcare cost so much? And, I don't know. It's just kind of a vicious cycle. So that'd be my ultimate hope, was that, again, the understanding that, images don't always have to hold just damage, or we can see quote unquote abnormalities on imaging, but that can be okay too. And for the large majority of people, that is okay. And hopefully that it might not change that person's viewpoint when they're sitting in the exam room with me on day one, but gosh, maybe they share that with their kids, or maybe they share that with their friend, or, yeah, what I found out is degenerative disc disease. Well, shoot, my PT has degenerative hair disease and his head doesn't hurt. So this can be okay. Yeah. So
ooh, I see what you did there. Very creative.
Degenerative hair disease.
Yeah.
Casey doesn't know.
By the way.
That's luscious.
I do degenerative skin disease. I got these beautiful smile lines. So
wrinkles on the inside.
Yeah, I got wrinkles on the inside and outside, baby. Back's killing me right now.
From a full life of laughter.
Yeah. From joy and joy. Yeah, I would echo that sentiment when we talk about imaging. But I would say, from a profession, I hope we keep pushing for the ability, even though we know what the research says, because I do think that's valuable being a frontline provider to be able to test for a red flag, and then to be able to send somebody, if they have somebody with them, like head over to the imaging center and get this MRI right now. I'm sending the order over.
How about this? In your guys' practice right now, and Nick, I know you're not as much in patient care anymore, but I mean, you probably have some good numbers from when you were all day. Like, what percentage of your volume is direct access?
My volume's probably pretty low, just based on the chronic pain population I treat closely with the doctor. But we do have therapists. Our dry needlers, that's I don't know the number offhand, what the percentage would be like, but I would high. I mean,
is it
well over 10%? I would guess with those guys.
We're well under 10.
We should. You can track that.
Yeah,
we should really talk about tracking that stuff
for
more. Very important figure. I'd say
because that I would say it changes, right? That would change the need for imaging too. I think is like if you're now basically the ortho walk-in clinic, you need the ability to do those things. But it's like when you're working with people that their MOI was 6 months ago, probably a little less valuable to have that in that case.
Yeah, like this dude that I emailed on Monday, he's basically direct access. I don't know how he went about it. He had like some long kind of convoluted story on how he got a referral from a physician with Mayo, so all the way across the state, but has never really seen him. It was just a call placed, for kind of mid-thoracic pain. So I'd say, you're right. My volume is nowhere near as high as it used to be, but from a percentage standpoint, it's a lot more direct access with people who have just, gotten to know over the years and want to request that, or
repeat business,
word of mouth thing. So
I definitely think
there's value to it. I think as I've said it already, I feel like I'm beating the drum too much, but I'd love to be able to. I mean, I'd love to be able to have that to support it in the right situation. And, it only brings value to what we do and what we claim to be.
Mm-hmm. And I mean, it is, I don't see that overutilization very much, because I would say in the last 3 years, I probably have 2 patients I can think of that I, probably caught on red flags that I had to send out for imaging. One was the DVT this week. And then the other was Cade equina. And both, she was positive for Cade equina and he was positive for DVT. So, I mean,
wow,
it was good catches, and so I mean, we do our due diligence. I mean, it's not like just would be willy-nilly.
I know I had a rotator cuff tear one time. Had a hip fracture one time. She had a THA. She was like maybe 9 months out, and came in and just had a really rough presentation, wasn't even able to move it. So we got her referred back, and sure enough, she had a fracture. The stem kind of loosened up, and I think the shaft kind of spiral fractured too.
We had one of those situations, and when I was back in the hospital, it wasn't my patient, but a coworker.
You caused it. No,
it wasn't me.
No, you established that. You're reckless, cowboy.
I refuse to see those people. I'll send everybody else in to see the troublemakers. No, but it was kind of the same thing. She was walking and she's like, this doesn't feel right.
Snapping hips and cracking necks.
I'm catching red flags left and right, Nick.
I'm thinking now too. I bet I've sent probably 6 or 7 people out for ultrasounds for DVTs. None of them, thankfully, have been positive.
See, you're an over.
Yeah, you're the problem, Jeremy.
Yeah, in the 10 years that I've been a PT, I've sent 7 people out. I mean, I'm just sending them left and right.
It's swollen and red. Well, I'll show you.
But I always say, in that, right? An doing a Doppler ultrasound isn't like we're ordering a freaking MRI from a cost standpoint.
That probably costs like $100.
Yeah.
You guys we didn't even touch on this, but what do you guys think about like diagnostic ultrasound from a PT standpoint? Like that's a thing PTs do now.
I've heard it's a nice revenue generator.
Yeah,
I think it would
that's
be a
all
good.
I know about it is that I can make money doing it, but I don't know if it'd help my practice very much.
Well, it's
Oh,
interesting in how many research studies have used that to assess though they've used it to assess tendon tears, but also, muscle thickness changes,
Yeah, like it
abdominal
just
walls. Oh, we got a visitor. We got
I
a
know.
guest on the pod.
Oh!
That's my little blondie. Yeah, no, yeah, it's whenever I see those studies, it's always like tendon thickness change, morphology change, multifidus fatty deposits, and like that stuff seems like even more of a reach than what we're doing with the other stuff to find issues.
Yeah.
It's like
How are you showing success with treatment? Well, their fatty deposits in their multifidi have shrunk a little.
well, and it's interesting because I did like a mini research study with the University of Jamestown on that, just with some of our back pain patients, and they brought their laptop based. That's the Jimmy's on the horse.
No.
I think. So, but yeah, it was cool. Like they had this little ultrasound head that just plugged into their laptop, and it was kind of fun to sit there and watch them do it because they walked me through what they were looking at with the patient, and this is the multifidus, this is rector spinae or whatever. Like, it just looked like black and gray lines to me, but.
I think it's so great to have additional tools. At least at your disposal. It's up to you and how you use them.
Yeah, I mean, it's like I said, it's cool, but clinically, I just didn't see necessarily the utility of it.
Give me an ROI, I can see Doling.
Yeah, I can see, from a research standpoint, but
there's a lot of cool things I'd love to have in the clinic, but I'm never going to.
Yeah, listen to you chew my butt on the ROI.
Well, what? That's probably 20 grand.
And that they were actually doing that study to try to justify the low cost, because I think that ultrasound laptop combo was probably like $1,000, and then the company was trying to validate some of the accuracy of it and try to get the cost down even further.
There, Jeremy, $1,000.
And they were looking at making ones.
Scrooge McDuck still has first quarter.
Yeah, their next step then is to make ones that would just plug into your phone. So you just have to buy the head and the software. It's kind of the next step. So
and then a monthly subscription.
Yeah, probably.
Think about that. Think about how cool it'd be though. All those times, like I don't know, I'm kind of a nerd for that stuff, and I still visualize the netter. I visualize the netter in my head when I'm like working on people and like which muscles should be firing. Wouldn't it be great to be able just to
bring it out and
transiently like assess it?
All those trigger points you could see with that ultrasound.
All those trigger points, we could see it.
You could watch the needle
ultrasound guided dry needling.
What? You know what though, Casey?
Mike dropped Casey.
That might be a come to Jesus moment for Doling when he's got the ultrasound there and he's like, "There's no trigger point."
What?
What did I do? What did I do?
Yeah, then I'll just stop.
His brain explodes. The ultrasound explodes.
It's all bringing us closer to the truth.
Fine.
True. The truth
is
out there.
Test retest.
Let's see it. Yeah.
No, I've gone back and forth on it, but
it's a slippery slope think the other way, though. Right?
I think I have settled on the lack of clinical utility with those. It would more be a toy I would be playing with to kind of look at.
But the scare. I'm just gonna say I'm gonna make an argument against that other point, like and maybe this isn't exactly who he is, but like the Adam Meekins of the world, where they just kind of deconstruct everything in the world of therapy to the point of like, then what the hell are we really doing? Then why don't we just all retire? Why don't we find another career then? If nothing that we do is proven to be effective by every single RCT out there.
Yeah, no, there's balance, right?
Yeah.
But there's also
balance. It doesn't feel like that balance exists in our profession right now.
It doesn't, like because
it's
still got your old timers that are like kind of drinking the cultist shit, and then you got this new wave that's like, well, nothing really works. Look at this. I'm gonna shit on this video. Watch this. I'm gonna crap all over it.
Oh, I
this is the dumbest thing ever.
You know what I would say is I don't think it. To me, how I take it, it's not that nothing really works, but it's the understanding that nothing works all the time. That's always my problem with systems. It's like, you just got to do this. You just do this for every patient. It's good. It's like, that's just not reality, right? Like, and the ability to to think outside of the box, you know.
Do you think that there's a loud enough voice for people who think that way, or there's enough of us out there?
You know, I do think that is where he's coming from. Honestly, this is how I take it. It's not to say like, let's blow this up, nothing works, but it's just the idea.
I have never seen a positive video on his.
Take one of his courses.
He's been on his stupid stuff rant for a while.
It's just a rant. The rants,
stuff,
like I get it.
You gotta get people to watch you. Yeah.
Some of it I totally get. We showed like the liver manips one time, and it's like, yeah, that stuff's garbage, right?
Mm.
But you know, some of the other stuff, it's like, come on, like you gotta
he's just out there to question. I think Greg Lehman does the same thing. Like you got to question. Although Greg Lehman has really, I think, mellowed out quite a bit in the last few years, but. We say this too when we teach, is I probably said this on before, where kids are like, why do we learn all this stuff when like none of it matters, right? Like you teach us stuff and then you go, but the research says, we can't support it, or it's low evidence for this. And it's like, well, we need you guys to realize that it's not that none of it matters. It's that like all of it matters, right? Like it's
correct.
Like this specific rotator cuff test in a vacuum probably doesn't matter. You combine that with presentations and social determinants of health and lifestyle, and you like start to create a picture of how to treat this person successfully. This
person, agreed.
See, we're more alike than we like to admit, aren't we?
Yeah, I think we argued for the fun of arguing, but it's just I think we're all arriving, and I would think, like Jeremy says, I think the Adam Meekins of the world arrive at a very similar destination that we arrive at too. It's just what's your persona, what do you do to get there? But I do think it is good to question some of the assumptions we've had in our profession for 30
I think
years.
questioning is just fine.
And we still have again,
but I'll go back. I think again, I like that you said persona, because these guys are all establishing themselves as like, their own unique social media presence. It's about the followers, the views, stuff like that.
Because I dare to bet he makes more money on Instagram than he does as a PT.
Completely, yeah. It's the same. It's the same argument the other way with like Kelly Starrett that I used to dog on you about for those few years. He's kind of on the other end where he's willing to try anything and
don't live in the cave. Don't freaking live in the pain cave, man.
I want to go in the pain cave.
No, you don't.
I want to live in the pain cave.
Because once you live there, then it's home. It's comfortable.
Yeah, then you're fine with it.
Yeah,
that's all. That's
like
pain cave's all right.
Acclimate in the pain cave.
Those are all about like David. That's special people. Those are like the David Goggins things, the Cameron Haynes things. But Courtney DeWalter, like live in the pain cave, get used to it.
Yeah,
and nothing can hurt you.
Yeah, I would say he's a special breed. Goggins is a special.
There's more than just Goggins, but there's some ones out there that push yourself. Maybe that's I keep shifting all the time, and I'm not afraid to like change some of what I'm verbing to patients too. And had a guy today where I literally called out my dude today at noon. Like he's talking to me about how he really was on this real distance endurance biking kick for so long, but then his buddy like moved to Fargo, and just haven't been able to do it since then. I'm like, well, that's your problem. You gotta find it internally. You got to be willing to push yourself, because you can't rely on other people to push you all the time.
Ooh, you know what though? I have no doubt that you presented that in a very eloquent and articulate way, and matched it to the patient. No, matched it to the patient, right? Because we talk about that, right? Like how you can talk like, bro, da 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 da, blah blah, or you might be like, well, I also enjoyed the soft hits of 78.
I do.
You wouldn't believe what was number 1 in July.
But I'm genuine that way. I legitimately do.
Yeah, I would just say like you have that ability. Like I can say I've seen it, right? Like so, but I think too much, right? Like the polarizing views. I think like you called me Hurricane Jeremy, right?
One time, right? That was a decade ago.
Yeah, but here's what I would say is like I think some people live there, right? This is what the research says. This is wrong. this is wrong. Like,
Yeah.
I've heard it multiple times, like throughout the years, like people like arguing with patients over ultrasound or over whatever it is. Like, and it's like, you are losing that person over a 6-minute treatment, right? Like,
yeah.
You lost that person, you lost that ability, right? Like, it was one of the very first.
I'll say this, especially if you make them feel really dumb.
Correct. One of my favorite things is, like I said, like the longer I practice, it's pretty freaking awesome, like how well people know their own bodies. Like, I'll compliment people like that all the time. I'm like, yeah, you're spot on. Like, like, hey, like, this is exactly what I'm looking at too. And and it is like, people do have a pretty good idea, and like over and over and over again you hear, no one listens to me. I told them this, they said I was crazy, right? Like, it's just like,
what fires me up? You know what really fires me up, dude?
What gets you?
I'm gonna be positive here.
I like it.
Literally in the last 2 weeks, I've had, I think, 4 or 5 patients, 4 for sure, who've all come back on a subsequent visit and told me that they've re-engaged in like some form of a fitness program after, whether it was our eval or a follow visit, because it's about like empowering people. We need to be moving towards empowering people to take control over their lives, take control over whatever impairments they got.
Yeah.
And let us just kind of guide them on that journey.
Yeah.
Not be shackled by, like we've talked about, imaging. But imaging can also, if you educate people the right way, in the honest way, it can be an empowering thing too.
Yeah.
Like, you're tough as hell, like, right? You might have these things, but you're fine.
I still can't believe you're not like, you're walking. I still can't believe
how you walked in here, but
you are so tough. I can't believe you're walking.
So strong. So strong.
You're almost as strong as He-Man.
Oh, the master of the universe.
The master.
I see things where they say He-Man stronger than the Incredible Hulk.
No way.
There's lots of people argue about that.
We'll never
world. He-Man's supposedly the strongest person in the universe.
Yeah. That was a good discussion. That was a joyful discussion.
I like it.
It was good.
Thanks for teeing that up, gentlemen.
Good fire. We'll have to keep it going. We'll have to find another one. So this week, top 55555 is our favorite cartoon series growing up.
Yay.
Yeah, it's just a fun little throwback to kind of a lost generation, lost time. No other criteria than just that. What is your top favorite? And I know I went last week. I can go first. I can go in the middle. I mean, how are you guys feeling about your lists?
I can go first. I don't think I ever go first. I feel like I'm always the
I'll go middle.
Jeremy Sandwich.
I wasn't gonna go middle. I went last time.
Oh, you went last. I'll go last.
Me in between you two.
I love going last. I have plenty of time to talk garbage then.
We'll listen intently for like 7 minutes while you break it down.
Yeah. You guys both have great breakdowns. I can't remember this far back. So it was just
this was animated by Hanna-Barbera. And then taken over, then transferred over to Filmation, I believe, in like 1984.
Filmation. That was not a great company.
Oh, excuse me. They're in my top 5. All right, Jeremy. What's your number 5, my brother?
My number 5 is DuckTales.
Woo!
That's what I had in my notes.
I stole it from you. You won't talk about it.
Sorry.
It literally says DuckTales. Woo! Great theme song. Man, always so much adventure packed into each episode. I don't know if you guys ever dreamed about, like, in your backyard having a silo full of gold coins that you could dive into.
Yeah, it seemed very realistic as a kid, but now as an adult, I'm like, you just break your neck diving in.
Kill you to dive in.
Scrooge McDuck made that look so smooth, and he'd like swim in it, right? And you're like, this looks sick.
Hey, what was the name of the second richest duck in the world?
Ooh, I don't remember.
Because Scrooge was Scottish and the other guy was Irish, right? They're playing off.
Oh, we should produce that.
Yeah,
Produce
that's
it.
good stuff.
Produce it.
Great stuff. Huey, Dewey, and Louie. I mean, they were the great drivers of that show, right? Weren't they the ones always kind of like getting into the shenanigans? And
Yeah,
usually
right.
history?
Scrooge was just the enabler.
Flintheart Glumgold.
Flintheart Glove.
I would have never guessed that. Actually,
That's great.
That doesn't
That is
sound
money.
familiar at all.
Is he Irish? Is he?
I believe so. He wore a kilt, if I'm remembering correctly.
Okay, so he could have been Scottish as well.
Yeah.
Scots.
But the other character I loved in there was Gizmo Duck.
Yeah,
Remember that?
Blather,
Like-
Blatherskite.
Yeah. Gosh, what a good.
Magic words.
Yep. So
Did Darkwing Duck spin off of that too?
Oh, come on! Don't steal on my list here. Just leave
sorry.
leave it lie.
Okay, that's awesome show. Awesome show.
Yeah, it's definitely on my short list for sure.
It is. It's on my short list too. It didn't make my top 5, but it's on the short list. It was right there. Great one. Anything more you want to add on that?
No, I rest my case.
All right.
Case
All right.
rested. Video
My
game is
number-
great as well, by the way.
My number 5 was
SNES.
was only number 5 because of its short-lived run. And Casey and I have had some dialogue about this offline. Well, technically online, but not online here.
Don't tell me it's number 5.
From 1985 is
Oh,
The Adventures of John Blackstar.
oh,
Black
only
Star,
5.
My
Fun.
favorite Native American astronaut who traveled through a warp zone and ended up in a different dimension and world.
Who's
Fights
your
the evil
second
Overlord.
favorite Native American astronaut that traveled through
I
time?
gotta get back. Yeah, that one. But John Blackstar was awesome. Super cool show. Kind of predates He-Man. There's a lot of similarities there with the mythology and the Star Sword and the Power Sword being kind of separated out. Just a cool show if you haven't seen it. It only made 1 season. Somehow a lot of this too, and you'll hear a recurring theme, was based on my brothers, especially my older brother and I having different VHS copies of this stuff. And that was really how we watched these shows, and got used to them that way. So I never knew until I became an adult that it only lasted 1 season, because I thought it was awesome, and had little Trobbits that helped him out. They were based hobbits. We talk about ripping off, Tolkien, but just a cool show. Good versus evil every episode. Yeah.
Did you
kinda fits-
exclusively digest this in VHS format?
Correct. I do have a DVD of it.
Ooh.
I found on eBay. Gosh, that's 20 years ago already too.
Yeah.
Somebody had transferred it. It's just like a homemade DVD transfer. It's got the whole season.
They
Media
had the
delivery
VHS
system
DVD
ever.
combo.
VHS.
Yeah, it
That's
was
my
one of
favorite
those. We watched a lot of. They were called Just for Kids. It was like a VHS company that took a lot of weird shows and put them in compilations like that.
Okay.
And yeah, that's where I first found out about that show as well. I enjoyed it. It was a kind of cool. 85 to have like Native American lead. It was a little different.
Yeah.
So and I guess I'd have to go back and watch it because I haven't watched it since I was a kid, but it wasn't like overly stereotyped, was it?
No, he's just a stud leader.
Yeah,
Yeah.
right. I mean, they didn't play on that really at all, did they?
Yeah. No, not necessarily. Not that I can recall anyways. And
Yeah.
I've rewatched some of it with my boys just to see, and they like it too. I mean, they kind of dig, and that'll again be another recurring theme that I bring up. It's like how well this stuff holds up over time.
Kids
And
dig
when you rewatch with your kids, do they like it or not? Does it carry over? So
Mhm.
it did. A couple of the episodes, especially, there's just some fun stuff in there.
Cool.
All right, Case.
I'm
what's your
familiar
number?
with it. Yeah,
What's your number
so
5?
my number 5, like we said, we didn't have a lot of criteria. So my minimalist criteria was age 12 and under. So
Ooh, I like that. I think
I
this
felt like
fits
when
for
I
me,
turned
too.
13, I threw
Might
away
fit.
childish things, became a man. So
Mhm.
this is my growing up stuff. So that did preclude a few shows that probably would have been close on my list, like South Park or Dragon Ball Z. Two shows that hit right around the age 13, 14. So my number 5 ran from 1987 to 1996, and this sucker dominated. 193 episodes. I was all in, every toy, every comic book, and it was Teenage Mutant Ninja Turtles. Still can probably sing the theme song. It was Saturday morning cartoon. We got 2 channels growing up, ABC, CBS, so this was one of those. Yeah, and I probably watched all 193 episodes. I just recently bought all however many seasons on DVD for my kids. We throw it in the car on long road trips. So
what'd you think about the movies?
Like the live action ones?
Yeah.
Growing up?
The originals?
Yeah, those were great, man.
And then how about the new ones?
Not so much. I don't think I hate them as much as other people. Just because I've probably absorbed Teenage Mutant Ninja Turtles in lots of different mediums, from comic books to all the different series.
They've had a lot of ideologies and a lot of a life. I mean, they've really lasted.
They came back as a new animation too, didn't they?
Yeah, I'm not as much of a fan of that where they're in like the future now. It's almost like a Teen Titans Go version of Teenage Mutant Ninja Turtles. And I don't like that as much because I like my Ninja Turtles a little serious.
There were some cool concepts in that first run. Definitely the Generation 1 run.
Yeah, and I will say probably the only reason it's not higher on my list, because I loved this show as a kid, was now going back and watching it with my kids, I'm like, oh man, this is a little cheesier than I remember. Like I thought it was such awesome karate,
some of that cheese is good,
sword fighting, and like I thought they did these awesome things, and then you realize like they never like use their weapons at all in the cartoon, and they maybe hit a fire hydrant with a bow staff, and that was like the extent of it.
What's fun?
And then they retired and they ate pizza after that.
Just live long lives.
My kids my kids and their friends will still debate over like which one they'd want to be, right? Which is the coolest?
Really?
Which one? That's fun. Like they're like, Dad, which one are you? I'm like, I'm a Leo guy, and then maybe Raph.
I pictured you as a Raph guy. I was always a Donatello kid.
Same.
Corey, you said that. You're a Donatello?
Yeah.
Jeremy.
Yep.
You're a Leo. Come on.
I'm not gonna crumple to peer pressure.
I would have went with Rat King myself if I was to guess what you were.
Fletcher. He's a radical rat.
What villain would you be?
Yeah.
Out of that show?
Yeah.
Super
I would have
Shredder.
either been Bebop or Rocksteady.
Super Shredder.
They were good.
You have such a self-effacing personality. A Bebop or Rocksteady.
I will say, when you talk about Teenage Mutant,
you're so smart. You're a Baxter Stockman.
Oh,
thanks.
Nice. If you like nostalgia, like the original Teenage Mutant Ninja Turtles, though, when Nickelodeon redid it with the 3D, probably mid 2000s, which is a far superior show actually. Near the end, like the last season, they do one where they actually bring the turtles from the original cartoon from an alternate dimension in with them.
What?
And it's so fun because they play on the fact that like they actually didn't know any ninja moves. And like Shredder comes from the old series into the new series, because in the new series at that point Shredder's already dead. So this Shredder comes in and he tries to get like Bebop and Rocksteady to work for him, and he just grades them like.
Was it still voiced by Uncle Phil?
Yep. They bring all the original voice actors back, and it's funny because Raphael's voice from the original show does Donatello in the new show. So they play on that too. Like, you sure sound stupid. Like,
that's deep. That's some inside cool. Yeah.
But yeah, it's so funny. So like Shredder's like telling Bebop and Rocksteady, like just berating them like he did in the original cartoon. And these guys are like, we're not going to take this. Like, we're in a union. And they just beat the crap out of him because they like
in a union.
They like actually know how to fight. So they just destroy him. And he's, it's tongue in cheek. It's funny. It's clever. That's a cool, it's like 2 episodes. It's like a back-to-back episode thing if you got Hulu, or no, it's on Netflix now. They moved over to Netflix. Just watch it for those 2 episodes. Yeah. It's super funny. You'll laugh. If you like the original cartoon, you'll laugh just how they play on it. Because like Shredder and Krang comes to, and they, they tell all these jokes and they just laugh at their own jokes.
Evil brain.
The new Bebop and Rocksteady are like, why are they laughing? What are they laughing at? Like, it's just funny.
And also a great video game.
Totally. That's a whole nother. We've done that. We almost got to do that again.
Yeah, we'll have to do an arcade one. Yeah, they just came out with a new like Ninja Turtle side scroller on Steam. That's like kind of like that would be the third.
That's what my son Connor told me that. Yeah.
Yeah, it's supposed to be awesome.
They also, I saw some ads for like what they call like the Cowabunga pack or something. So they've repackaged all the original games, like every Ninja Turtles game, and then it all fits on like your PS5 disc or whatever it is. So cool.
That's my number 5.
Great choice. J-Bone.
4. My number 4. This probably would have been right around the time. Nah, it was before that. I hadn't hit 12 yet, I don't think. But Animaniacs.
Oh yeah.
Yakko, Wacko, and Dot. They were crazy to the max. No, it was just like kind of the Tiny Toons, like kids WB era. Again, one of the only, and this is why I feel like I don't have many older cartoons, because I don't think we even had any type of TV until I was like 7 or 8 or something like that. But that was one of the channels that we got. So I can't foreshadow with some of the other tunes that were in that, but that was just a great afternoon block. Just fun, just all over the place.
Because like
4.
Pinky and the Brain was Animaniacs. That wasn't Tiny Toons, right? They came from that. The Pigeons came from Animaniacs, right? Yeah, they had like a lot of cool side characters.
That's right.
Yeah, they did.
Yeah.
I can't comment on that because it might be late. So.
Animaniacs, a lot of adult humor, like that, like wise kind of tongue-in-cheek innuendo humor that you probably didn't catch all of it as a kid, but it was just wild. They were insane. It broke the fourth wall all the time, which Tiny Toons kind of did too. Yeah, I was a huge fan. Animaniacs, because I think they came on right after Tiny Toons. It was like a 1-2 combo.
It was, and then you're right. Pinky and the Brain was right in there too. So it was just a nice like hour and a half or 2 hours of goodness every afternoon. So.
Yeah, that magical 3 to 5.
You get home,
Yeah.
Awesome.
Great choice. Yeah, did you watch the revival? I think they just came back, right?
I did not yet.
I don't know if
I
that
should.
was
I just haven't. I have not watched cartoons in forever. Like when you brought this up, and I was just like thinking back, I was like, man, they were. That was the jam. So, I need to check it out.
Cool.
All right, I watch is cartoons now. My son's 6. That's like the perfect age.
That is perfect.
That's good age.
Kids cartoons nowadays, pretty sweet actually. I will say some of the new stuff's pretty solid.
I got a lot of Peppa the Pig right now. So
Peppa the Pig. Also
solid. You'll move beyond.
She's on the short list.
Did not make mine.
No. My number 4 was G.I. Joe, the Real American Hero. Gosh, really, I mean, growing up, that was driven, and who knows, maybe it's more nostalgic for me, driven by the toys that I had.
Oh yeah,
100%.
That was pretty sweet.
Some of the best commercials on Saturday morning cartoons.
Oh my goodness!
Yeah, these kids live in a rainforest. I know.
Yeah,
so mad I could never buy the sets they had.
My friend Ryan and his buddy Eric, or his brother Eric, had like the most extensive collection of G.I. Joe toys. It was so much fun to go over there and just like set everything up in battle. It was awesome. But the show itself was awesome. Felt important. You had a clear delineation of good versus evil again. G.I. Joe versus Cobra, and lots of diverse characters. On both sides of the fence, and then you had good messages at the end. They're the ones that really stuck out to me. There's a couple of shows that did that, but this one for sure. They try to teach you a life lesson, which I think is awesome. And
Joe.
And I know it might be corny by today's standards, but I think there's value in that. I think it's good to have values and to reiterate that. And then finally, a very sneakily underrated movie that I think is very, very good if you gentlemen have not seen it.
Yeah, that movie hit me hard because, like, was it Hawk Duke? One of them dies right away, right?
Duke.
Yeah. And then Cobra Commander turns into an actual Cobra. Right?
Yeah, there's a lot of mutation stuff going on there.
It's a heavy movie.
Globulus.
Between that and the Transformers movie,
Let's not get ahead of ourselves, Casey.
That
But
was a load as a kid to handle those two movies.
You're right. They went darker, and obviously
darker.
the knock on that too was that both those movies were kind of they're cash grabs and also attempts to kind of hit a reset button on some of the action figure lines and then have new characters to kind of sell.
Yeah.
But it was still sweet new villains. Globules was an awesome villain in that cartoon in the movie. Voiced by Burgess Meredith. You guys know Burgess, right?
Familiar with
Rocky's
the name,
yeah. He was the guy, he's Mickey, Rocky's trainer.
Gotcha.
Yeah, good stuff. Don Johnson was the main guy too. Came as Flint. So that's my number 4. G.I. Joe, the Real American Hero.
Did you guys have any favorite toys growing up? Like characters, toys wise?
Oof, we might have to do a top 5 on that. I don't want to spoil it.
We just might have to. But yes, of course.
I don't know. I don't know if I could. But
if we're talking just straight G.I. Joe, definitely Snake Eyes. I mean,
Snake Eyes was like the coolest. He was the coolest G.I. Joe. Everybody.
My favorite was Bazooka.
Really?
Yeah.
Okay.
It's probably one of the only ones I own.
I always wanted the vehicles. The vehicles were like where it was all at.
And that was so expensive. But they were probably like
had-
$20 back then, which is like the price of a toy now for my kids, like the cruddy toys. But they seemed
so
unattainable.
Creative. Like when you look back, the creativity behind some of those vehicles was just really cool too.
I do have a sad G.I. Joe toy story. I forget the guy's name, Nick. I'm sure you'll know. Who's the dude that could like? I don't know if he could change skin color, change his appearance.
Yeah.
Start with a Z, I think.
Not Zartan. Zoltan. Zoltan.
Yeah, but
another movie. Underrated comedies.
So the toy, if you set him in the sun, he went from like normal G.I. Joe colored to like dark.
Yes.
So I was like, how dark can this guy get? So we had like this crawl space. Don't ask, guys. So we had this crawl space and we had the light bulb like in the side of the wall because I don't know, we wired it that way. So I was like, I turned the light bulb on. I set him on the light bulb and I'm like, let's easy bake up in this thing. See how, I came back like half an hour.
Yeah.
It was just a pile of melted plastic. I was like, oh, Zartan. No,
Zartan.
He did not get very dark, actually.
He
got much melty. So
that
was
those
super,
are good.
Super
and
sad.
the movies weren't terrible. I mean, for what they are, they're really not all that bad. So
like the new
all
ones or the cartoon one.
The new one, I still haven't seen Snake Eyes, but I saw those.
That was decent.
Too. Yeah, it looks like it's in my Prime watch list, so I'll get to it sometime.
Whew,
All right, Casey
4?
Case.
All right.
Yeah.
1986 to 1991, 140 episodes. This, if you're talking toy lines, probably one of my favorites. If we did a top 5, I won't reveal the exact number. Would be the Real Ghostbusters. This thing was good. It was a little inconsistent. The first 2 seasons are awesome. The rest of it kind of gets a little lackluster. They brought in a company after the first 2 seasons to try to make it better. And they really geared it towards children. That's when it kind of made the switch to Slimer and the Real Ghostbusters. And they started to do those weird like side stories with Slimer and like the cat and stuff. But the first 2 seasons are so good. There's so many awesome episodes I could think of. The Halloween episodes with Sam Hain, he was super creepy. The Boogeyman, if I watch those episodes, I have him on
the best.
Yeah, have him on Prime. That guy's voice, I don't know offhand who did his voice, but that dude created the most terrifying voice in the world. And I was a little afraid of the dark as a kid, so like the idea of a head popping out of the closet was just horrifying.
Yeah.
And if you look at a list of like the top 10 like creepiest scenes in the Ghostbuster cartoon, there's some that were not for kids. They had some pretty good writers too. If you look at
they set good tension.
The writer list were people that went on to do some pretty good writing in series later on. So it was awesome. The characters were great. Peter Venkman, Egon. I was an Egon guy, no surprise, being a Donatello guy. Kind of that same thing. Which Ghostbusters would you be? Not a lot of people, not a lot of Winston folk in North Dakota.
Careful. I was a Winston guy.
You were a Winston guy?
I was like a Winston / Peter, and they let Winston breathe on the show. I mean,
Yeah, he was
he had
way
a lot
better.
more to do on the show,
which is sweet because
I'm a Peter Venkman.
Yeah, you're a Peter 100%. But like, it's funny, like the guy that actually did Winston in the movies auditioned for the cartoons, and they went with Arsenio Hall instead.
Yeah, that's right. Arsenio,
slap in the face, right?
Poor
like,
Ernie Hudson.
Yeah, like I'm literally that guy. Like, you won't cast me, and they're like, yeah, Arsenio's more likable. So yeah, that's my number 4. Man, I could wax and wane on stories from there. Yeah, there's so many good episodes that sit with me. Probably, and that's probably why it's above Ninja Turtles. Is there's probably not a lot of like single episodes of Ninja Turtles where I'm like, oh, that episode was so good. It was just the idea of it. Where Ghostbusters, I could tell you 10, 20 episodes.
Every episode felt kind of important, right?
Yeah, and it was a cool story, and you just never knew, I wouldn't say there was a lot of filler.
What are you laughing about? Don't choke on your wine.
If anybody can give importance to Ghostbusters, every episode felt kind of important.
The kid, it did. Shut up, Jeremy. Just go to your number 3.
But yeah, it's when you say that though, there.
I love it.
When you watch it, there's like an animation variability between like the first 2 seasons, anyways. And that's because they did because the second season of Ghostbusters is 56 episodes. Yeah, so they hammered out a ton of episodes. So what they did was they took all the scripts and picked out the stories like they thought were the best, and they sent those to like a well-known animation company, and then the rest of them they sent overseas to like China or Japan to like these lower grade animation companies just to bust them out. So when you watch those first 2 seasons, that's why some episodes look quite a bit different than other ones. So just a interesting side.
Yeah,
because you think like 56 episodes in a year, that's crazy.
Yeah, that's more than 1 a week, right?
How do you know that? I love that. I love that. This is great.
So that's my number 4.
I knew I was gonna get some like next level analysis. And I'm like
these cartoons.
Yeah, and I'm like, I'm scratching my brain to be like, what did I watch again?
Yeah, you were like,
but that segues into my number 3, actually.
New Kids on the Block.
Darkwing Duck. It was kind of like, right? Wasn't it kind of like Disney's Batman?
Yeah, 100%.
Yeah, Drake Millard and Launchpad McQuack.
Launchpad McQuack.
I mean, that was cool. Like, he was mild-mannered at home, and then just let's get dangerous, right?
Yeah, let's get dangerous. That's good. Yeah. They had awesome villains.
They did.
Cool villains.
But that was not, if memory serves me correctly too, I feel like that was only on for like a couple of years too. Like, I don't know how many episodes or what animation studio it went to, but that was like, in my mind at least, like it was a super short-lived kind of run.
It'd be Disney, right? I mean, that's still be a Disney property. Yeah.
Yep. So, and I think that was some of the first like Disney channel that we had got.
Was DuckTales the introduction of Gizmo Duck, or was it Darkwing Duck?
So I think Gizmo Duck originally guarded the money silo.
Okay.
Right?
I think.
But then I think he had a larger role, if memory serves me correctly, on
cartoons were so different back then. So it was on for 2 years, 91 and 92, but it was 91 episodes.
For over 2 years,
yeah. And that's another fun fact is when you signed up for these cartoons, if you chose to just be a network only cartoon, you had to go through ABC, NBC, whatever, and you had to do their ways and means. But if you went directly to syndication, which is what Ghostbusters did, and I'm guessing what Darkwing Duck did, you got to bypass all that ways and means, so they could make episodes way faster because they didn't have to go through this whole process. So that's why you did see a lot of cartoons in that time frame put out a ton of episodes in a short time, because it all went direct to syndication because cable was getting big.
Syndication was huge back then. In all platforms.
Which is interesting too, and that's how I probably consumed a lot of Ghostbusters. Is I mentioned this on another episode. My grandparents had like the big satellite dish.
We had one too,
and I didn't realize this, but as kids we always watched what were called wild feeds. They would just be random channels, and they would just play like Ghostbusters nonstop, commercial free for hours on end. And I didn't really get it as a kid. And as I got older, I thought it was maybe like a copyright thing. Like, well, you have to air episodes to keep your copyright. But what I found out in my research for this is what the wild feeds were. Was back then, CBS would have lots of local affiliates. You'd have one in Devil's Lake, one in Minot, one in Fargo, but they'd have, Central ABC. And what they found was it was too expensive to ship because they had to ship physical tapes typically to places if you're going to watch a show. Okay, so what they would do is they would put these wild feeds on the satellite, and the stations would record them.
Tape them off of it?
They would tape them off the satellite, because if you want, that's why they're commercial free, is you'll find 10-second blanks on those wild feeds.
Yep.
And that's where the station then would split it apart and put a commercial in.
Pause for station identification.
I didn't realize that as a kid, so that was cool. So I was watching Ghostbusters before it was even airing live on the networks.
Oh, interesting.
You were underground before underground
syndication.
There were certain shows that still, like a Dallas would still deliver their episodes because it was, the spoilers, and they didn't want people to sneak them off the wild feeds. I mean, that's still illegal to record them and put them, but especially mid 90s when they started, with the internet craze, people were starting to record them and put them on the internet. Mm-hmm. So then they had was kind of the end of wild feeds, and they went to digital feeds and stuff. But another fun aside.
Wow,
that is a great fact.
We have tapped into Casey's passion project.
Wild feeds.
I knew this was going to be big.
Big break into syndication. We could go on a rabbit trail into syndication discussion too. That was kind of the rebirth of a lot of television sitcoms and stuff. Give them second life.
Oh yeah.
But I'm going to jump into my number 3. It's already been said.
Fine.
Casey did a great job of deconstructing it, but mine was the real Ghostbusters. Legitimately spooky. You hit the nail on the head. It's so funny that you said those two villains, because I think the Boogeyman had 2 episodes. I think they devoted to him at different times. I think he came back at one point. Such an awesome villain. And it was. What about the Boogeyman had like the hoof feet. Yep. But there's a better villain. It was like the Grundle. Do you remember Grundle who turned the kid into he was trying to create another Grundle by turning the kid. And that episode was so fantastic.
One of the creepiest episodes. So the head writer on that episode, he typically, if you follow the first 2 seasons, he did about 25 episodes, wrote 25 episodes in the first 2 seasons. They're typically some of the better ones. So when they went with this company that came in and said, you got to make this more kid friendly, we can't have all this scary stuff, he quit. And then season 3, the ratings tanked. And they actually called that writer back and said, we need you to come in and try to save this show.
Naturally.
And he was like, well, I'm not going to follow any of the rules. And they went back and forth. And that was the only episode he wrote in season 3 was that episode. And then they
it was that late in the show?
Yep, and that has a way different tone than the rest of that season, because that's one of the darker episodes.
Yeah.
And then they ended up bulking on changing all the things that this company had said. So that was the only one he did in that season. But it's by far the best episode in that season.
Yeah, great stuff. You hit it. We already dissected it a little bit, but they give a chance on the television format, even if it's cartoon, it gave every character a little life, a little something to grow with. There's also a funky one where I remember them, this sticks out, where they were eating potato chips, but the potato chips had a mutagen in them. And that wasn't good either. They was all over the place, but really a good show.
The episode where they went into Walt Fleischman was the Walt Disney character, and he was in stuck in the cartoon world. And they have to go in with all these cartoon characters and save him. That's a great episode.
I was such a massive Ghostbusters fan the way it was in the movies, so I couldn't get enough of it when it came out on cartoon stuff like that. But it wasn't. I remember it was on some type of channel we did not routinely get. So
I would guess I was in the same boat. If it wasn't for the satellite, I probably
didn't have the wild feeds.
Yeah, you needed the wild feeds.
I remember, I can still distinctly remember staying at a hotel in Bismarck as a kid and watching an episode just cheesing because I was so happy I was able to do that,
But I do remember the Sam Hain episodes. I remember them airing them on network on Halloween in the evening, being a big deal. Because as a kid, I put it on. It was the one thing I put on my calendar, 7 o'clock.
And it had a lot of roots. I mean, I'm sure you know this better than me, but it's still a lot of the roots were rooted in real mythology. I mean, they had the whole story of Sam Sawain was really true to the Irish like mythology of it. And
yeah, they did.
darn
cool
bugger
job with
kept
that
wanting
stuff.
Slimer. I mean, he should have just left Slimer alone.
Yeah, they had a lot of cool mythology. I mean, they did some Cthulhu stuff on there. They did a lot of different, they did even some Christian stuff with breaking the seals and the end of the world. They had an episode about that. I mean, they some pretty heavy stuff, they did 4 Horsemen of Apocalypse, and there was a lot of stuff that was not off.
Makes me want to go back and rewatch with my kids.
Oh, load it up, man. You can get it on DVD cheap or
get
Amazon
the wild
Prime.
feed. Get the
wild.
feed.
Oh, I'm on it. Right. What's your number?
We watched them all in one weekend.
My number 3, 1992 to 1995. This show is phenomenal. Changed how I viewed cartoons as a kiddo. And it's interesting. Like it wasn't like directed at kids at the time. It just felt like it was made for like people who loved film and cinema. It was Batman the Animated Series.
Oh yeah,
what a great
totally
show.
Blanked on that one. Yeah.
Just this dark, gritty, you had the like Tim Burton's Batman, which was like a real gritty. You had Frank Miller's comic book Batman. But then this like animated series took that and it like made that the Batman persona. Mark Hamill's Joker is just, I mean, that is the Joker for me.
Yep.
It introduced Harley Quinn, which is now one of the more famous Batman characters.
Yeah.
And every episode was like, there was an overarching story, it wasn't a serial deal. Like you kind of follow Batman and these villains would get arrested one episode and 4 or 5 later, they'd get busted out because they were still in prison or in Arkham. It was just cool. And like it humanized the villains too, though. Like not many shows were doing that at that time, but you really got to see like what made the Joker tick over these episodes. And like Two-Face, you got to see that change in him. And it was just cool. Like it just, and they pushed the limits. That was a show where they went back and forth with the editing committee on what you could show on a kid show and how intense you could make a kid show, and they let them get away with a lot of it. Like it was very cool. It was I was a big X-Men guy. The X-Men cartoon was huge for me, and I wasn't a Batman guy, but I would say X-Men would probably be 6 on my list, but Batman definitely stands the test of time more than the X-Men cartoon, just based on that storytelling is phenomenal. If you've ever seen it, give a few episodes a shot, not just to like enjoy it, but just to see like, boy, that was such a change in narrative that has now followed through into shows like Samurai Jack and things like that going forward that were really changed how people, the Spider-Mans, the original Teen Titans, not the Go version, just this serious superhero stuff. It was cool. It definitely was animation changing. So number 3.
Gosh, you name dropped some things that are kind of making me kick myself a little bit, but just like you, like I didn't have either Batman or X-Men on here because I don't know, I was more of a transient fan then, but I viewed it the same way, like yourself. Under 12.
You should be kicking yourself right now.
I am. I'm totally doing it.
You weren't 12 at the time that Batman came out.
I would have been.
92,
it came out like 92, wasn't it?
Yep, 92 to 95.
Yeah, so I would have been 10, but kind of on the tail end.
In your prime.
Yeah, but it didn't hit with me. It didn't stick quite as much.
I had to go to my grandparents to watch it because that was a Fox show. But that Fox run was so solid. That was X-Men.
It was a good show. I remember
that was X-Men and Batman back to back.
Yep.
And X-Men was really solid. X-Men had some awesome stories in there.
Best theme song.
All
right. Is it better than
Captain Planet? He's a hero.
I forgot about it. Gotta take pollution down to 0. No, I was gonna say they're Pinky and the Brain. Pinky and the Brain. One is a genius, the other is insane. They're laboratory mice. Their genes have been spliced.
This is your number 2. This is Pinky and the Brain.
This is my number 2. Man, this was right in my WB wheelhouse. Like again, you talk about 10 being on like probably the upside of like your prime, I guess, of cartoon watching. This was right in the middle of mine, like 8, 9 years old. And right, like I did remember this piece of like, I was looking up some stuff. I'm like, that was definitely one of my jams, but like, I always remembered the Pinky, are you pondering what I'm pondering? and then Pinky would always come with like, I think so, Brain, but you know, like that was his lean in, right? Like,
yeah.
If they called it sad meals, kids wouldn't buy them, right? Like, just always had some freaking drop in there that it's like, you know, obviously he's like, he's on the cusp of taking over the world, and Pinky's just in his own world. So, and I definitely said Narf for a while in my younger years. I mean, like, I don't know. It was just a good gig. Again, hit in that like 2-hour time zone of happiness from like, whether it was 2:30 or 4:30 or 3 to 5 or whatever it was. But, yeah, it's my number 2, Pinky in the Brain.
Yeah, all that stuff kind of has its origins in like of Mice and Men too.
Yeah,
like the big dumb friend, and then the really smart guy who's always got a plan, you know.
And he always had a plan. Never really worked.
And that's been used a lot in different cartoons over the years. And you know, South Park's lampooned it really, really well too, with, you know, even the same exact concept with Nathan and then his sidekick Nimsy, who's always getting him in trouble. Nimsy. But yeah, that's a whole nother. Yeah, very offensive.
Very offensive.
It's on South Park, so it's not considered
Nathan
offensive.
has Down syndrome and he's super genius, bad guy. Okay, my number 2 is He-Man and the Masters of the Universe. I believe from 83 to like 85. I think it only truly ran like 2 seasons in its original run. Maybe that was his total run. But awesome show. Again, based on like my early childhood memories, and then just being able to rewatch these things on VHS like we did repeatedly. It might have only been like the same 6 or 7 episodes. Man, we had those things memorized. Loved the hell out of them. Great villain. Skeletor is a great villain. Easy.
You want to try it one more time?
Spies. Yeah, Jeremy.
Yeah.
He-Man.
It's good.
Damn you, merman.
It's better than your Cobra Commander. I
Yeah,
don't want to crap on your Cobra Commander, but your Skeletor is solid.
Crap away. I've been perfecting the Skeletor one for many years. My kids just love that one too. But Adam was Prince of Eternia. His faithful cat Cringer was just needed that extra, you know, oomph to become Battle Cat, and then he was a badass. But yeah, the whole cast of characters perfect for a toy line.
Yeah.
Interestingly, we had very few of the He-Man toys.
Oh, really?
The ones we had, God, we loved them to death. I think my brother had a Skeletor. I had a He-Man. Well, he had Skeletor and Panther, and then I had He-Man and Battle Cat, and it was just like it was on.
Oh, that Panther though had like a felt to it, or
it was a felt
helmet. It got so
What
gross.
is that, velvet?
Oh, it's so disgusting
But they
after
didn't-
about
but they
2 or
didn't-
3 years of playing with it.
Yeah, it'll rub off most of it. But they didn't do that with Battle Cat. Like you get plastic.
Yeah, fun fact, I still have Moss Man in one of our plants here in the house.
Oh yeah.
You want to talk about a gross toy? Moss Man has collected a lot of filth in 30 some years.
I believe that.
You would.
Yeah, my wife, she was very disgusted by him when I found him at my farm. I'm like, look, it's Moss Man. She's like, that is gross. I'm like, oh, you should see Panther.
Yeah, but awesome show. As I said, super great.
This is bad.
Yeah.
Skeletor had his sidekicks. You had Merman. You had you had Cyclops. You had
Merman.
Evil Lynn. I mean,
Merman.
Merman.
Yeah, like you said, just the classic, like, let's bust out a toy line, you know, Man at Arms, Fistor, the guy with the big fist. Like
Fistor. Yeah.
You know, it's like they just came up with ridiculous
Tila,
names and made
Man of
characters
Arms,
to fit it.
Yep.
But no, I was a big He-Man guy too. He was that's a good show.
Yep. And it was a great intro because the intro just explained everything about it.
Mm-hmm.
So you could jump in at any point in time, never see a single episode, and you totally know what's going on because he is Adam, Prince of Eternia. You know,
Yeah, just that classic old cartoon where it was just like the voiceover on this beautiful, quiet, calm scene as he's like,
when I held aloft
explaining the
my
character.
magic sword and said, by the power of Grayskull. Awesome. I'm not going to go into that yell, but yes.
Don't do it.
One more time, I'll go, Casey, that was my number 2. What is yours?
Damn you, Skeletor. My number 2, which I assume will be instantly given away when I
Come
get
on,
the years
you
out.
blabbering buffoon.
Yeah, there you go. Was that Shredder or Skeletor at that point? It's hard to
Oh, now you're offending me.
tell. 1989 to the present. It would be The Simpsons.
Simpsons, yeah.
Again, we didn't get Fox, so actually one of my like dad's friends recorded it on VHS for me and would bring me like a season at a time, and I would just digest it, had it on VHS and I'd watch all the time. Those first couple years of The Simpsons, probably like the first 10 seasons of The Simpsons, is really good storytelling. I mean, it was funny, as a kid, you like Bart. You get a little older, you start to like Homer. And then you get to be a grown adult and you just love all the characters, and you can appreciate like the cast of characters they built over 34 years or whatever it is now. And then as I got older, we finally got a satellite dish past this, but I would come home every day, and that magical 3:30 time, I think it was on, and I'd pop the VHS in and I would record every episode. And I had like the Simpsons guide book, which had like every episode and the description and like the air date. And so I made a piece of paper with like every episode I recorded, because it was on syndication, so it wasn't in order, so I'd have to find it. And I'd write down a description of every episode, and I had it all, and I'd share it with my buddies. And it was just cool. It's good memories, great stories. That's another show where I could tell you a ton of good episodes that really stuck out in my mind.
Every Treehouse of Horror.
Oh yeah, they were awesome. So I remember the first time I saw Treehouse of Horror, I was probably like 5, 6. And I was like, I didn't understand that like you could do one-off episodes like that. I was like, they've killed Homer. Like, what's happening? The series is over. And then like the next week, they're like, yeah, that's just
kidding.
Just kidding.
Yeah.
Didn't really
That became like the Treehouse of Horror became like an event for me and my friends every year. Like we were so excited to see what they do.
Yeah,
which movies they would, because they were always spoofing a movie.
Oh yeah, the Gremlin on the school bus one always sticks out in my mind because
Twilight Zone. Yeah,
for whatever reason, again, Nick, you could probably echo this. We watched a lot of movies we shouldn't have when we were kids, and the Twilight Zone movie was a big one we watched. So I was very familiar with the source material for that. So I love that episode.
Yeah, they did. They did a ton of The Shining. That was a big one. It felt like they devoted almost a whole episode to that, but I'm sure it was just one segment of it.
Yeah, that one was good. The one where the janitor does the Friday the 13th, where he like is on fire and he like comes into the PTA meeting and they're like, "Have a seat, Willie." He's like,
he sits down and waits.
Sits down on the chair on fire. But generally, that's kind of creepy episode though too.
Because he goes around he does kill like all the kids.
Yeah,
I mean, it was awesome though.
Maggie plugs the bagpipes with her pacifier and he explodes.
Oh yeah, that's right. Because he turns into like a giant spider
thing.
Yeah.
So that's my number 2, Simpsons. And it's funny, like I felt like I watched that show forever. I probably watched the first 15 seasons of it. So like I haven't even seen half of the episodes of The Simpsons.
Yeah,
that's crazy to think.
When you said present, I was like, "What's he talking about?" Then when you dropped The Simpsons, like, yeah, that's right. They're still going. It's wild.
Yeah, I think the next episode, the next Treehouse of Horrors, is like episode 666.
Whoa!
So
eat my shorts. Eat my shorts. Cowabunga, dude.
Yeah,
do the Bart man.
That was also a good video game.
No.
You didn't like it?
Oh, the arcade one was solid. Come on, it was at every hotel in the world.
No.
We'll agree
There's
to
no
disagree.
NBA Jam. No
we'll
NBA
see.
Jam.
Let's
No
talk.
He's on fire.
We'll talk top 5 arcade game list someday.
Go ahead, Jeremy. Let's hear your top dog.
Do you guys have a favorite comic book character of all time? Have we talked about this?
I don't know if we've talked specifically. I've said how garbage Superman is.
Yeah, he is garbage.
Yeah,
Like,
totally.
we had
garbage.
to have read the comic, like based on comic reading specifically.
No. I would just say whether it's DC or Marvel. Nick, I feel like you'd be like a Wolverine guy. It was like that.
Yeah, if I was
There's
gonna,
some awesome Wolverine stuff out there.
yeah, I'd probably go Nightcrawler. Oddly enough,
Really?
big Nightcrawler guy.
Nightcrawler.
Yeah,
Wow.
I always
You
thought
know,
he was
like,
cool.
I'll be
Next to the
honest.
Germans.
Mhm.
For me, it's like I would say like longevity wise, it's been Batman.
Oh, okay.
Like we used to watch on TV Land, like the old like
Adam West.
Powie,
Yep.
Shablammy.
Yeah, we had some of those on VHS as I was a kid too.
Take me to TV Land. But no, anyways, that's my segue into my number one. My number one is actually the Batman the animated series.
Oh.
Good
So that was
choice.
like again my prime time, like 7 to 10 years
Yeah.
old, right there. I would say ultimately like the new movies and stuff, outside of like Dark Knight and that sort of stuff. Like even the new one disappointed a little bit, but
Really?
yeah, it wasn't my favorite.
They all like to ride the darkness.
They do.
Everybody's like, we gotta be the darkest Batman.
But I would say I thought I agree with Casey. Like it was a little bit more edgy. I like the animation. I like the storytelling. I bet I need to go back and rewatch them, but I bet I've seen every single episode of that.
They're really good.
And they are really good. That's for me my all-time favorite cartoon. Like talking
Awesome.
childhood. So
Yeah, I would say like Batman the animated series. I read the comic books. Like I felt like the animated series had better writing than the comic books did, which I can't say for a lot of those shows.
see, and we didn't have I didn't have comic books. Like we didn't have a
Jeremy,
store
I
in
believe
town
they
or
sold
anything
comic
like that.
books at every drugstore. Every Ben Franklin's you could go to had comic
No,
books.
we had in Canby, we had a Dubers, and they did not. I'll tell you, they did not.
You didn't have the
comic
rack.
books.
You did not
Nope.
have the rack. Wow.
Nope.
You know what
and
else
they
I could
didn't-
buy at Ben Franklin? I could buy the Fangoria trading cards. Casey,
Really?
you know what I'm talking about.
Oh yeah, that's interesting. Yeah, Ben Franklin's. That was you could get goldfish, comic books,
Fabric.
toys,
Fabric.
beads. You could make beaded crosses for all your friends. They had everything.
Our soul GI Joe toys.
I
Yeah,
don't
we got
think-
Ninja Turtle
never
toys.
afford to buy.
Really? See, we had to go to Walmart and Marshall for
It was a
G.I.
weird
Joe
store.
toys. But you know what? I want to bring this up too before I'm done because I told you guys that like Bazooka was my favorite G.I. Joe.
Please do. Yes.
I produced this. Do you know where Bazooka was born?
No.
Where?
Hibbing, Minnesota.
What?
No way.
The Iron Range?
character.
Wow.
Mic drop.
Did we
How?
ever
It all
find out?
comes together.
Did
How
we
is
ever
that not
determine
on a
how
sign?
far is Hibbing from Green Bay, Wisconsin? Did we ever find out?
62 hours.
Is it a
That's
bazooka
so
blast away?
It's a one bazooka blast away. I
Bazooka?
couldn't believe it because I'm like, I was
Cool.
thinking about it, and then I'm like, guys, is this even a real character? I was starting to doubt myself. I'm like,
Or
no,
was it
I
like
remember.
another character who
Sounds
just shot
real.
a bazooka once?
I remember
Bazooka.
his hat, and he had a literal bazooka. I'm
Yeah.
like, one of my
Sure he
favorite
did.
toys. And so I looked it up. It's like his birthplace in the universe is Hibbing, Minnesota. It's just unreal.
Heroes come from
Can't beat
everywhere,
it.
Jeremy.
Can't beat
Yeah,
it.
yeah. Shout
Wow.
out Hibbing.
You got it. You squeezed all that in, and good number one. I mean, again, I think there's so many. You know, when you're calling me out for like the age comment, you make a good point, but I think there's other factors that end up playing a role, like especially when you're going through adolescence and like when you
Oh, yeah.
move out of cartoons, like
Yeah.
like I was a middle child too, so I had an older sibling that was always like, nah, you know, like this.
That's lame.
He was always ahead of the curve, right? His
Yeah.
brain, that sucks.
That's
right?
lame.
And so you move away from stuff maybe sooner than you could should, you know. But I still had a
I was
younger
wa-
brother. So my younger brother Ty would watch like he would watch a lot more Ninja Turtles. He would watch a lot more of Batman, and he would
And
have
then you-
X-Men on. And then I have like one eye on it, being like, "Ooh, this ain't like
That's
X-Men."
actually
You
pretty
kind of
cool.
did you pass it on though? Like you was.
I think I know
Baby-
sold it. God,
This is
what do you-
baby stuff.
Yeah,
Still
why don't you
watching
go like kick some dirt, man?
I'm gonna go watch Predator again.
Yeah. Okay. See, I was the opposite. My older brother was like a Dungeons and Dragons dude, big time.
Okay.
So like he's watching like anime and stuff, and I'm just like, oh boy, there's a lot of tentacles on this show. That's weird.
Why is
Like,
that person's head exploding?
Yeah. So I cartoons are always always cool in our family. So I never got cartoon shame too much other than school, but
that was my life. Shame.
Other than the rest of my
other than the entire world. Home was the pain cave. There was lots of cartoons in the pain cave when I got home.
Living in my pain cave without my secret love for cartoons and glam metal.
Yeah.
My brother, when I was getting like Motley Crue's Dr. Feelgood, I remember being so excited to show my brother, like, look at this, got this. And he's like, they suck. I'm listening to Metallica and Slayer. It's like, what? What? All right.
It's the devil's music.
They don't suck. All right. My number one, pretty easy, pretty obvious for me. It was Transformers Generation 1. Again, based upon a handful of VHS copied cassette tapes that we had. Awesome show. I don't know how long it had, 3 or 4 years, Case, maybe 5 even, but first 2 are what the first I can give you a little Transformers history, right? And I'm sure Casey probably knows this, but first 2 seasons predate the movie. And then the movie was released in 1986, and then they tried to kind of reset the universe a little bit. And again, big cash grab type of move, reestablish a whole nother group of characters and stuff like that. So really my Transformers love really begins and ends with those first 2 seasons as well, because they never really hit as hard after the movie came out. They killed off Optimus Prime. And I mean, Optimus Prime was like such the great guy. I mean, he was like such the ultimate hero. And you go and you killed him off, you transition to Hot Rod, and then they tried working at Rodimus Prime. And, it just didn't stick with me.
Yeah, they did like a lot more spacey type stuff after that too, right?
Yeah.
Like a lot of transporting to and from the home world and stuff.
A lot of world jumping.
Yeah. I didn't like it as much after that either.
Plus again, we didn't have cable. We didn't have the benefit of syndication. So what I was relying on was whatever I could get on our own VHS. And then if we were lucky enough to like rent something at our super stop.
Yeah, and I'd have to look at timeline too. When did Dinobots come into the equation?
Oh, they were season 1.
Okay, because they were the bomb. I was a huge
Grimlock, man.
Grimlock was so badass.
Sludge.
Yeah.
I mean, the whole line of characters, and you know what elevates it for sure is my son Gunnar got into Transformers like 2 years ago, and they've had an awesome resurgence. And Walmart in general, if you go through the toy aisle, you'll find a lot of these retro toys. They've retconned them now.
Stores, man, those are awesome.
They've actually repackaged, like whether it's Transformers. Casey, go there. They have the real Ghostbusters, the original toy lines back.
I know. What? No need, because I still have mine, Nick.
Do you?
I should have brought them down.
I had an Egon, and I pointed out to my kids. I'm like, this is what I had. And it even had like the ghost that went over his his head, and slime him. And they had this
which, by the way, Kenner Ghostbuster slime was the best slime ever made.
Smell. I can still smell it.
Yeah, right? And it like gooed so
whatever chemicals we were like
oozed over stuff so well.
And it dried up so fast. Though.
Yeah, but it will ruin your Panther if you cover him in
it. Panther. Keep him off my Panther, damn.
Yeah, that wetted that right down.
So they have what they did though. They took like I want to say it was 2 or 3 years ago. They started like taking and packaging up these toys with the original exact packaging of like the Gen 1 stuff that I would buy when I was a kid. So I bought in Gunner like Optimus Prime, Jazz. Jazz was a great Autobot. He's a Porsche. Bought him Starscream, Megatron. I mean, Megatron's a fantastic villain. Still bummed out you didn't call Jeremy Megatron because he's our Calvin Johnson on the pod here.
It was a reach. It was too much of a reach for me. But Megatron Megatron was a cool villain, but he sucked that he just turned into a big gun. Like I hated that part of him.
Yeah, and how he could, and somehow he fit in Starscream's hands.
Yeah, like that kind of sucked
as a gun.
But other than that,
okay, one little thing.
Yeah, that's I was gonna say that's like the only thing though. Do you remember the GoBots, like the cheap version of Transformers? Like I was a huge fan of them. Like they even fought these rock guys, like the GoBots versus the rock people.
There was GoBots, but there's Mask. Mask was kind of a little bit derivative of Transformers.
Yeah. Yep. Much crappier. Yep. Yeah, Transformers was solid. Like I said, that movie, again, as a kid,
movie is
watching
great.
Optimus Prime die, you're like, what?
One shall stand and one shall fall. And then
I believe.
Like, but why is it you? Why are you dying?
And that's like Orson Welles' last movie, I think.
Yes, it was. It was,
and
literally
also his highest grossing movie, I think.
What? I thought it bombed. I thought that's why they ended up shelving G.I. Joe and then releasing it on TV instead of putting it out theatrically.
Yeah, and I could be wrong on that.
You're right. You're right about Orson Welles. He was Unicron.
Yeah, and I think that was his
Red
last
Hot Judd Nelson played Hot Rod.
And Nick, you must have loved that soundtrack.
Oh my God, so good.
That was the cheesiest.
Oh, so much Stan Bush on there.
Rock soundtrack of all time. Me and my buddy still. You got the power. Yeah, you got to move. Me and my buddy still sing that when we lift. Like,
yeah,
so cheesy.
And plus, we were actually watching some Weird Al the other night, and Dare to Be Stupid's on there.
Oh yeah,
that's a good one. Yeah, but that's my number one, Transformers Generation 1 animated series. Generation 1.
Not bad. I was definitely more. I don't know what channel that was on because we did not get a lot of it. Like I felt like it was. I would watch reruns on like USA at my grandma's.
Yeah. I don't remember seeing it. Honestly, guys, I don't remember watching it on TV ever. I think it was always on a VHS tape.
So yeah, the toys were more how I digested Transformers, and then I don't know, just
sweet.
The toys were sweet. But again, cartoons never went away in my household. So when Beast Wars came out, that was prime Transformers. Those toys were badass.
And they're good. They're kind of like a puzzle now. I mean, when you open them up, they still have the same instruction thing. They're like, 18 steps to transform him from a car to a robot. And
like you can figure out easy.
Here you go, Gunner. Here's Mirage, and it keeps him occupied for like 30 minutes before it ever becomes, Dad, can you do this for me?
It's like a Rubik's Cube.
It is. It's a little. It kind of is.
Yeah, I think my problem with the Transformers line was, again, you digest it as toys, and I think Optimus Prime was like one of those like too expensive to have toys. Yeah. So if I couldn't have Optimus Prime, I didn't want any of them. Like,
you didn't want a Bumblebee?
Yeah, what am I gonna do? Ride around on Bumblebee? I did get a Grimlock at one point, but
there was some badass one. Ironhide. I mean, they had some awesome stuff.
And like I wanted the like Constructicon where you put them all together.
Devastator,
and huge guy. But again, that was like
was Devastator.
It's beyond. That's beyond.
You had to buy like 6 of them to like put them together.
Yeah, it seemed cool. I always saw it on the back.
We didn't have that kind of ching.
No, no.
G.I. Joes were like $7 a pop, and that was like a real special thing,
Yeah, because I think some of those G.I. Joe toys had some metal on them back in the day, if I remember correctly, but I could be wrong on that. Yeah. Some of the first gen ones.
Yep.
Yeah. Oh, good choice. My number one, from 1993 to 1997, so oldest on the list. Cartoon I should not have been watching as a child. But I can say me and my brother would watch
Beavis and Butthead.
Beavis and Butthead. Number one. My brother and I would go over to my grandma's at, I don't know, must have been on like 8, 9 at night. And my grandma would sit there and read her romance novels while me and my brother watched Beavis and Butthead. And like, I just laughed and laughed and laughed. I'd never.
They're making a movie?
Yeah, it just came out. Yeah, Paramount Plus. Yeah, Cornholio.
That's a great look for you, Jeremy. You got it. That's our thumbnail.
And Cornholio.
Yeah, I need TP for my bunghole. Like, it was just so funny. Like, and as a kid, I connected with those characters because of how dumb they were and the stupidity. That humor was just where I was in my life. But it's funny now to go back and watch and be like, there's so much of that Mike Judge, like, social commentary in the background, and it was much cleverer than I would have ever thought as a kid. And that show was nonstop laughs. I was a big music video guy, so when they would do
the music
videos, the commentary,
Yeah.
Oh, man.
That
And it
part,
sucks.
those stick out.
Yeah, and it sucks because you can't digest, like they won't release those, like if you buy the DVDs and things, you don't get those with it because of copyright infringement and things.
YouTube.
Yeah, I assume you could go on YouTube and watch them, but like those were so
I have.
funny. Those were the best parts of it because he kind of smartens Beavis and Butthead up a little on there and really gets into some commentary about it. And sometimes it's dumb, but like it's pretty good commentary on the videos. And I don't know, Beavis and Butthead, man,
it's fun.
Loved every episode of that thing. I watched. They used to do the marathons where they'd have like 8 hours of Beavis and Butthead, and me and my brother would just sit at my grandma's and watch that nonstop every episode.
Yeah, it's great. That's a great show too.
Yeah. I think I talked like Beavis for about 2 years. I'm sure my parents wanted to murder me, but
everybody just loved that.
Yeah, the grunting and fire.
But I did enjoy exactly what you're saying. I enjoyed their commentary during music videos better than I liked the actual stories in their episodes. I thought those were the funniest things. Like the Pantera one, if you remember, they're watching This Love. Is that right?
I don't remember offhand.
They're like, wow, why is this guy so angry?
Yeah.
Right, got a mean stepdad. His dad's like, God damn it, Pantera, clean your room.
Yeah, I remember when they were watching like Korn Blind, and he gets the part where he's like doing the scat, and Beavis is like blowing on his thumb to like make himself lightheaded so he can like just talk gibberish. It's like it was just stupid stuff like that. And I mean, it pushed the envelope as a kid. I felt badass watching it, because everybody it was
edgy,
and it was the end of civilization, and that's right on the edge when I was becoming a teenager. So I was badass. I wanted to be a rebel. So Beavis and Butthead was how I was a rebel. So that's my number one.
I probably would have had it up, but we didn't have MTV obviously. So it was like, and I more just hearing about it, watching it in hindsight now.
Yeah. Oh yeah. That MTV, man, they had that animation liquid TV there for a while, like the Max.
Daria, was it Daria?
Daria was afterwards. Yeah,
never watched a single episode of Daria.
That's actually really good too. Aeon Flux was big
would
right away.
Think so.
Yeah, that was like moody for sure.
You seem like a big Daria guy.
Yeah, some of those shows they had, like if you've never seen the Max, that's kind of a cool animation style storytelling. No. Look that one.
Aeon Flux. I watched. They made a movie out of it. Charlize Theron.
Yeah, the movie sucked, but
bombed.
The animation, the show was I think only like 16 or 17 episodes, but it was wild. It was crazy. As a kid, I didn't really get it, but now as an adult, you can appreciate what the stuff they were doing with those shows.
Yeah.
So.
Well, awesome, boys. It's good stuff.
Yeah, it was a fun list. Episode
25.
25. Quarter of a century.
I don't have any budget for fireworks or anything. So episode 25. Thanks everybody for listening. Like always, you guys got anything you want to hear us talk about? Top 5 lists. You want to be a guest? Heck, shoot us an email at ptshoptalk@gmail.com. Make sure you watch us on YouTube. Like, subscribe, all those things that people tell you to do. And until next time, I'm Casey Hansen. With me as always is
Nick Doling.
Jeremy Van Kloppenberg.
Oh,
you're supposed to step on me. All right.
You guys are getting better.